Just how more infectious is the Delta variant and what level of protection do the current vaccines provide against it? Let's get more insights from infectious disease expert and vaccine expert panel, Dr. Rontgene Solante. He's joining us via Zoom. Dr. Solante, welcome po to The Big Story.
Good evening, Robbie, and good evening to our viewers.
Okay, first off po, everybody I think is reading about this story coming out of Indonesia. These are medical frontliners reported to have contracted the virus despite having gotten their vaccinations. What is there to qualify about this report?
Well, we need the data in terms of how many of the total healthcare workers were vaccinated. And among these 350, how many died, how many were hospitalized, and how many developed severe or mild cases. No? I'm not concerned with this 350. In fact, if you look at also other real-world data with other vaccines, this is more or less the range of the breakthrough infections. And what is good about this is that I think most of those who developed the infection did not develop the severe form of the COVID-19 among these fully vaccinated healthcare workers. So we need to validate how many really were hospitalized and still survived. No? So that alone is an important data to us to validate.
Sir, maybe you could explain something for us and for our viewers, because I think ang basic instinct, ang basic reaction ng mga tao is, naturo ka na pala, nabakunahan na, bakit na hawa pa rin? Ano bang dapat maintindihan ng mga tao pagdating sa bakuna as well as the chances of you still getting infected?
Okay, no? So pag pinakunahan ka, no, like itong COVID-19 vaccine, no, your body will respond to it by producing an antibody specific to that virus. No? And iba't ibang tao, iba't ibang level ang antibody natin dyan. No? Depende yan sa level ng response ng immune system natin. No? And definitely, it's not zero. So there are those who will get the infection and then will not develop the symptoms. There are those who get the infection, develop the symptoms, but it is only mild. And based on interim data, yung na-infect, even they're fully vaccinated, majority of them did not develop the severe symptoms. No? So meaning, ang advantage ng fully vaccinated is that you have that antibody that will calm down and reduce the ability of this virus to replicate, para dumami. And that's where we want the vaccine to be given to everyone so that protection will be maintained for several months. No? So, hindi lahat ng nabakunahan hindi magkasintomas. No? So, yun ang unang rule niyan. Pag nagkasintomas ka, it can be mild and less of the severe. Pag nag-severe naman yan, then there's also a possibility that can be severe because your response to the vaccine may not be fully 100%.
Okay, Dr. Rontgene Solante of the Vaccine Expert Panel. Maraming salamat po.